Welcome to the deep dive. Today, we're going to be taking a deep dive into borderline personality disorder,
BPD.
BPD. You might be here because, someone who has it, or maybe you're just fascinated by the human mind.
Right.
But either way, you've provided us with a pretty dense chapter from a psychology textbook on personality disorders.
Yeah.
And our mission is to break it down, make it easy to understand.
Make it make sense.
Yeah. So to start off, personality disorders, they're more common than a lot of people think.
Oh, yeah.
We all have, our quirks, but when do those quirks become like a real problem?
Right. So the DSM, the Diagnostic and Statistical Manual, it groups personality disorders into 3 clusters,
Okay.
A, B, and C. So it's kind of like organizing your spices.
Okay.
But instead of, paprika and cumin, we're talking about different ways personalities can go a little off.
Got it.
That-
So where does BPD fit into all this?
So BPD falls into cluster B, which is known for being the more dramatic and emotionally intense cluster.
Ah, the drama queens and kings of the personality world.
Well, we try to be a little more sensitive than that. But yeah, cluster B disorders tend to involve difficulties with regulating emotions and impulsive behaviors.
Okay, so before we get into the specifics of BPD, can we talk about what actually defines a personality disorder?
Sure.
I mean, we all know someone who's a little extra. So when does extra become a disorder?
Right. So the DSM has specific criteria. It's not just about being different.
Okay.
It's about these inflexible patterns of thinking and behaving
Yeah.
that deviate from the norm.
Okay.
And these patterns cause problems in relationships, work, and other areas of life.
So it's got to be pervasive, not just a one-time thing.
Exactly. And it's not a reaction to stress. It's more ingrained than that.
Okay, so like if someone's really organized, that's fine. But if they can't function unless everything's perfect and it's hurting their relationships, that's when it crosses the line.
Right. Exactly.
So not everyone with a strong personality has a disorder.
Of course not. It's about severity and impact on their life.
Okay, good to know.
Yeah.
So back to BPD. What makes it different from other personality disorders?
Well, the hallmark of BPD is this intense fear of abandonment,
Oh,
coupled with a really unstable sense of self.
okay.
So imagine constantly feeling on shaky ground, never quite knowing who you are or where you belong,
Yeah.
and just terrified of being left behind.
That sounds really tough.
It can be.
Yeah.
And this fear can lead to really intense and unstable relationships,
Oh, yeah.
often characterized by what we call splitting.
Splitting, like
Yeah.
deciding between 2 flavors of ice cream?
Not quite. In BPD, splitting refers to this tendency to see people as either all good or all bad,
Ooh,
swinging back and forth between idealizing and devaluing them.
got it.
Like one minute someone's your best friend, the next they're the enemy.
So confusing for everyone.
Exactly. It can be really destabilizing. And then it's often paired with impulsive behaviors,
Okay.
some of which can be self-destructive, like
Huh.
reckless spending, substance abuse, risky sexual behavior, even self-harm.
So it's like this cycle of intense emotions and impulsive reactions.
Right. And those emotions can get so overwhelming it leads to paranoia or even dissociation. Like feeling everyone's out to get you or feeling completely detached from your own body.
So these are like coping mechanisms for the emotional pain.
Yeah, in a way, but they end up creating more problems.
It sounds really distressing. I'm starting to understand how challenging life with BPD can be, but how is it diagnosed? There are 9 criteria in the DSM, right?
Yeah,
Do you have to meet all 9 for a diagnosis?
not at all. It's not a checklist.
Okay.
It's about the overall pattern, the persistence of these traits.
Okay, so like our organized person example. Just being organized doesn't mean you have a disorder.
Right.
But if your need for order is so extreme that it really impairs your life, then it becomes clinically significant.
Exactly. It's about the degree and the impact, not just the presence or absence of certain traits.
That's helpful.
Yeah.
And these symptoms, they can fluctuate over time, right?
Yeah, someone might have periods of stability and then periods of intense crisis.
So it's not constant turmoil, but the potential is always there.
Right. And it's important to remember people with BPD are not defined by their diagnosis.
Right.
They're not borderlines. They're individuals with strengths, talents, and the capacity for deep connection.
That's so important. We can't lose sight of the person behind the diagnosis.
Exactly. We need to approach BPD with expertise and compassion.
Definitely. So let's talk about the causes of BPD. The chapter mentioned genetics and environment.
Right.
It's not a simple this causes that situation.
It's more like a web of influences. There's definitely a genetic component.
Okay.
Studies have shown that if one identical twin has BPD, the other has a much higher chance of developing it too.
So genes load the gun, but environment pulls the trigger.
I like that analogy.
Yeah.
And the environment, especially in early childhood, plays a huge role.
Okay.
There's a link between childhood trauma and BPD.
Okay.
Like abuse and neglect can be major risk factors.
Yeah.
Imagine growing up in an environment where your needs aren't met, your feelings are dismissed, and you're constantly exposed to chaos.
That's awful.
It's no surprise that this impacts their sense of self and their ability to form healthy relationships.
So BPD is often rooted in these early experiences of feeling unsafe and abandoned.
Exactly. But it's not just the traumatic events themselves, it's also the family dynamics.
Yeah, babe.
Like a family where a child's feelings are constantly denied or invalidated.
So they never learn to regulate their emotions.
Right, and trauma doesn't always look like physical or sexual abuse.
Yeah.
Emotional neglect and manipulation can be just as damaging.
So it's a broader definition of trauma than some might realize.
Definitely. And the chapter also mentioned rapid sociocultural changes as a risk factor,
Really?
like immigrants navigating a new world, struggling with identity, or anyone facing big societal upheavals.
Wow. It's amazing how these larger forces can impact mental health.
It's a lot to consider. We've got genes, early childhood, and even society all playing a role in BPD.
It's complex, but understanding these causes is crucial for treatment and for fighting the stigma surrounding BPD.
Absolutely. And that brings us to treatment, which is what we'll get into after a quick break.
Sounds good. So before the break, we were talking about all the things that contribute to BPD.
Right? Genes, childhood experiences, and even society all playing a role.
Yeah, a real complex web. But now let's talk about what can be done. What are the treatments for BPD? Is there a magic cure?
Well, I wish there was a magic cure for BPD or any mental health condition for that matter.
Right.
But the good news is BPD is highly treatable.
Okay.
With the right support, people can really learn to manage their symptoms and live full lives.
That's great to hear. The chapter mentioned an 86% remission rate 10 years after treatment.
Yeah, the American Psychiatric Association reported that, which is really encouraging.
That is encouraging.
Yeah.
So what are the most effective treatments? What can someone with BPD do to start feeling better?
One of the most effective and really the gold standard is Dialectical Behavior Therapy, or DBT.
DBT, okay, what is that exactly?
You can think of DBT like a toolbox full of skills to navigate those tough BPD moments.
Okay, so what kind of tools are we talking about?
Well, DBT focuses on 4 key areas: mindfulness, distress, tolerance, emotion regulation, and interpersonal effectiveness.
So learning to be present, writing out those emotional waves, managing feelings, and communicating better.
Exactly. It's giving people concrete tools to deal with the very specific challenges of BPD.
It sounds pretty comprehensive, and it works.
It's been shown to be very effective in reducing self-harm, improving relationships, and even decreasing hospitalizations.
Wow, that's impressive. So is DBT the only option for treating DPD?
Not at all. There are other therapies that can be helpful too, depending on the person and their needs,
Okay.
like cognitive behavioral therapy, CBT.
Is CBT similar to DBT?
They're kind of like cousins, you could say.
Okay, how so?
Well, while DBT is about building skills to manage emotions and relationships, CBT helps people change those negative thought patterns that contribute to their distress.
Oh, so retraining your brain to react differently.
Exactly.
So DBT helps you handle the storm, and CBT helps you avoid the storm altogether.
That's a great way to put it.
I like that. And it's not just DBT and CBT. There are other approaches too, like interpersonal therapy and some psychodynamic therapies.
Right? They can all be helpful often in conjunction with DBT or CBT.
So finding the right combo for each person.
Exactly. What works for one might not work for another. It takes some trial and error sometimes.
And what about medication? The chapter mentioned medications for BPD, but I thought personality disorders couldn't be treated with meds.
That's a common misconception.
Okay.
While medication can't cure BPD or address the underlying personality, it can help manage some of the more acute symptoms.
Like what kinds of symptoms?
Things like anxiety, depression, and mood swings.
So it's like a Band-Aid on a bigger wound.
That's a good analogy. It can provide relief and make it easier to engage in therapy.
Okay, so meds can help someone function better while they're working on the deeper issues in therapy.
Exactly. It's not either. It's about using all the tools available, both medication and therapy.
A holistic approach.
Right.
So with all these treatments, what's the long-term outlook for someone with BPD? Can people recover?
That's a great question. And the answer, like with most things, BPD is nuanced. We don't typically say cure when talking about personality disorders
Okay.
because it implies those personality patterns completely disappear.
Right.
But the good news is, with time and treatment, BPD symptoms often diminish significantly.
So maybe not a cure, but a real chance for improvement.
Absolutely.
Yeah.
It's about learning to manage emotions, develop healthier coping mechanisms, and build more stable relationships.
That sounds like a big change, but is it the same for everyone?
It's not one size fits all. Everyone's journey is different.
So what factors make it easier or harder?
Well, the severity of the disorder, the start matters.
Okay.
If someone starts with very intense symptoms, it might take longer to see progress.
Like starting a marathon further behind?
That's a good way to put it.
What else matters?
Relationships are huge.
Oh, yeah.
Strong, supportive relationships can be so helpful in recovery. Having people you can rely on who understand you can make a world of difference.
Makes sense.
But on the flip side, unstable or toxic relationships can make things worse.
So your support system can either help or hurt.
Exactly. And then there's the impact of past trauma.
Okay.
A history of abuse, especially in childhood, can make recovery more complex.
It's like you have to heal from the past and the present at the same time.
Right. It's essential to address those past wounds.
So trauma-informed care is super important.
Absolutely.
Mm.
And of course, access to quality mental health care is crucial.
Yeah.
Not everyone has equal access to therapists, affordable treatment, and community support.
Hmm.
And that's a problem.
It is a problem.
Yeah.
Mental health care should be a right, not a privilege.
Exactly.
So recovery isn't just about individual effort. It's about having a system that supports mental well-being for all.
You got it. It's about addressing the bigger picture.
So there's no magic cure, but there is hope for recovery.
Yeah.
With the right treatment support and access to care, people can live full lives.
I love that. It's a journey, not a destination.
It is a journey, and this deep dive is just scratching the surface of BPD.
There's always more to learn and explore.
That's the beauty of it. But before we wrap up, I want to go back to the stigma around BPD. Why does this diagnosis have such a bad reputation?
That's a great question, and it's something we need to talk about more here. BPD often gets a bad rap in the media and even within mental health.
What do you mean?
Well, people with BPD are often stereotyped as manipulative attention-seeking or difficult to treat.
Oh, wow.
And those labels can be really damaging. They prevent people from getting help.
So it's like being punished for having a mental health condition.
It is, and it's so important to remember these stereotypes just aren't true.
Right.
People with BPD are in a lot of pain, and their behaviors are a way of coping with that pain.
Okay.
It's not about manipulation. It's about trying to manage intense emotions and feeling safe.
So it's about seeing the person behind the diagnosis.
Exactly. We need to move from judgment to understanding.
I agree. We need more education about BPD to break these stereotypes and create a more supportive environment.
Absolutely.
Okay, well, I think it's time to wrap up this deep dive into BPD.
Okay.
We've covered the complexities, the challenges, and the hope.
It's been a great conversation.
It has. Thanks for joining us on the deep dive. We hope you found it insightful.
We hope so.
And we encourage you to keep learning, asking questions, and seeking knowledge.
Right. Because understanding is the first step toward compassion.
Well said. And one last thought before we go. Given how common BPD is and how connected it is to trauma, what can we do as a society to better support those who struggle with it?
Wow, that's a powerful question.
It is. How can we create a more compassionate world for people with BPD and their families?
There are no easy answers, but it's a conversation we need to be having.
Definitely. It's about fostering empathy, challenging stigma, and advocating for accessible mental health care for everyone.
It's about creating a world where people with BPD feel safe to ask for help without fear of judgment.
So well said. And on that note, we've reached the end of our deep dive into borderline personality disorder.
Thanks for joining us.
We hope you found it informative and hopeful.
Until next time, keep diving deep.
It's really amazing how much we've learned about BPD today, you know?
Yeah, it's a lot to take in.
But even after this deep dive, I feel like we're just scratching the surface, right?
Absolutely. BPD is so complex, there's always more to uncover.
Yeah, but at least we've planted some seeds for folks to maybe explore further.
Right. Hopefully this sparks some curiosity to learn more.
One thing that stood out to me was how important early intervention seems to be.
For sure.
The sooner someone with BPD can get support, the better their chances.
Absolutely. Early intervention is crucial for any mental health issue. But with BPD, it's especially important.
Yeah, because the sooner those patterns are addressed, the less ingrained they become.
Exactly. It's like anything else. The earlier you catch it, the easier it is to change.
So what if someone listening to this is thinking, this sounds kind of familiar. Maybe this is me or someone I know. What should they do? What's the first step?
Well, the most important thing is to reach out for help. Talk to a doctor, a therapist, a mental health professional.
Right.
There are resources out there, and there's no shame in seeking support.
I think that's so important to remember. There's still so much stigma around mental health.
Oh, yeah.
It can be really scary to take that first step.
It can be. But we're trying to change that. We're
Yeah.
talking about mental health more openly these days and challenging those old stereotypes.
That's good to hear. We need more of that, more understanding and compassion.
Definitely.
And I think knowledge is a big part of it. The more we know about BPD, the better we can support those who are struggling.
Absolutely. Knowledge can really help break down stigma and build empathy.
It's about creating a more inclusive and supportive world for everyone.
You got it. And remember, you're not alone. There are so many people out there living with BPD.
Yeah, and many have found healing and recovery.
It's true. Their stories are proof that recovery is possible.
There's hope and help available.
Absolutely.
Well, on that note, I think it's time to wrap up this incredible deep dive into borderline personality disorder.
Okay.
We've covered so much, the complexities, the challenges, the hope.
It's been a fascinating journey.
It really has. So thank you for joining us today on the deep dive.
Yeah, thanks for listening.
We hope you found this deep dive informative and insightful.
We hope it gave you a better understanding of BPD.
And most importantly, we hope it gave you a sense of hope.
Because recovery is possible.
Remember, you're not alone, and there's help available. Keep learning, keep asking